we still live in a fee for volume world. And so now it's a tough place for young doctors right now. And hopefully we'll adapt and change with the tide. But it's tough today.
Private practice, I think, too, the type of person that you attract is especially in orthopedics, because what I've found is the age-old story of I was an athlete, I had an injury, I figured out about the profession, and so I was inspired to become a surgeon. And so you take those people and they were likely, athletic, grew up in those backgrounds, and or, whether it was just for fun growing up and or collegiately, like they were, professional athletes. But, those are the competitive and entrepreneurial people that tend to do well in private practice. Not saying that people that didn't play sports weren't,
Sure.
aren't.
Oh, yeah.
But, it is that type of personality to where the same goes for in what I do. If you're not competitive, you won't do well because there's 1,000,001 recruiters and you've got to build up a name for yourself and trust. And it's not about where you hang your hat. I mean, it is to a certain degree, but it's also on you in private practice to say, if patients aren't coming in the door, what am I doing to go get them, right? Am I sponsoring little league teams? Am I putting myself out in the community to where people know who I am and know what I do and know what procedures I specialize in? And you talk to people and you can find out really quickly if they have that spirit or if they just want to be able to go to work and have patients come in. And it's like, go work for the hospital, right? Because you'll get that there. And I think that's important too when you're recruiting and trying to find that type of personality that will not only do well, but stay put because they've been able to build up that patient volume.
Yeah, I think that's really important. I also think when you're in a group setting, you want to recruit for the group. And what I mean by that is if I'm looking for a private practice, but I just want to work, I want to be my own guy and I just want to see patients and, I've got partners, but this is all about me, it doesn't work.
No.
You've got to have a completely strong team idea about things because the person at the front desk, in my mind, is equally as important as the physician in the back because that's the first person to see the patient. And if that doesn't go well, nothing else will go well.
Yeah. I mean, it's mastering that process and that
Yeah.
patient journey of, who do they see? Are they smiling when they walk in? Are they sitting in the waiting room for 45 minutes or?
Yeah, no, there's no question. And it's tough today because we still live in a fee for volume world. We are still paid by the number of people that we get through our clinics. We've talked for years about going to value-based care, and the CMS is working towards that slowly, but it has been much slower than what everyone thought it would be. And so now the new doctors coming out have one leg in this fee for service and, see more patients, you're not busy enough. And then they have one foot in this, slow down, listen to your patient, don't have your hand on the door, don't forget to order a physical exam. I mean, all the things that you really should do, but there's a lot of competing forces to survive. It's a tough place for young doctors right now, I think. And fortunately, we've got very bright people that are coming out and hopefully we'll adapt and change with the tide. But it's tough.
Thanks for tuning in to the Healthy Careers Podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details. It is. I remember I had somebody on the show who was sharing a statistic that I think it was something like in 2004 or now you have to see 40% more patients than what you did in 2004 to bill the same amount.
Yeah, no, I believe it. I don't know that number specifically, but you just take a total knee, for example. I know that reimbursement from Medicare is around $1,100 for a knee replacement that goes to the surgeon. And, when you ask a person on the street, how much do you think the surgeon makes for doing that knee replacement? It's usually $15,000, $20,000, $30,000. And when I tell them 1,100, and out of that 1,100, they have to pay all their staff and their overhead, then you begin to realize why someone is doing 8 knee replacements by 3:00 is the only way to be successful.
Right.
That's just the world we live in.
And it breeds the burnout factor too, in that
very much.
anybody doing that same repetitive thing. I mean, yeah, I'm sure, if that's what you do and you've done it for years, you could probably do it in your sleep, right? But
Yeah.
do you want your doctor doing it in their sleep, or do you want the surgeon to be, at their best and the top of their game? But the insurance companies have made it almost impossible for that. And
They've
so,
made it very difficult, and patients need to get more engaged. I mean, they have to take more responsibility. The problem is the internet gets in the way too, because it becomes the doctor. And so patients come in with questions they don't quite understand the nature of which, but by asking them, they feel empowered, which is great, but it creates, then the physician starts to go, oh God, here comes someone else who knows a little bit about.
right,
And so
exactly.
yeah, you just have to appreciate it and work with it, because the patient should always come first. If you work with that attitude, everything seems to fall in place. But
Yeah. Well, and I think a lot of people too, they either